Hello everyone, I'm Dr. Adam Maulana. I hope you and your family are always blessed with good health, happiness, and protection in everything you do. Today, we are going to discuss an ear condition that deserves attention, known as cholesteatoma. Cholesteatoma is an abnormal collection of skin cells that develops inside the middle ear, often behind the eardrum. Although it is not cancer, it should not be taken lightly because it can gradually grow and potentially affect important structures around the ear. In simple terms, the ear has a natural system that allows its skin to renew and clear itself. However, with cholesteatoma, keratin and skin cells can accumulate in an abnormal location. One factor that may contribute to this condition is Eustachian tube dysfunction. When the Eustachian tube does not function properly, pressure in the middle ear can become unbalanced. This may cause part of the eardrum to retract inward, creating a pocket where skin cells can accumulate. Cholesteatoma can also develop following previous ear problems or damage to the eardrum, while a small number of cases are present from birth and are known as congenital cholesteatoma. In its early stages, a person may have few or no obvious symptoms. However, as the cholesteatoma grows, several complaints may develop. These can include gradually reduced hearing, ear discomfort, ringing in the ear, and recurring fluid or discharge from the ear, which may sometimes have an unpleasant odor. In more advanced cases, a person may experience balance problems or a spinning sensation. Why does cholesteatoma need to be taken seriously? Because the abnormal tissue can gradually affect or erode nearby bones and other structures. One important area that can be affected is the ossicles, the tiny bones responsible for transmitting sound vibrations from the eardrum toward the inner ear. If these structures become damaged, hearing can become impaired. In more advanced cases, nearby structures such as the inner ear or facial nerve can also potentially be affected. For this reason, symptoms such as progressive hearing changes, recurring ear discharge, ear discomfort, ringing, or balance problems should not simply be ignored. An ENT specialist can examine the ear using specialized instruments, such as an otoscope or an ear microscope. If necessary, hearing tests such as audiometry may be performed to determine the type and degree of hearing loss. In certain cases, the doctor may also recommend a CT scan of the temporal bone to assess the extent of the condition and determine whether surrounding bone structures are involved. Treatment depends on the location, size, and extent of the cholesteatoma. In many cases, surgery is the main treatment because the goal is to remove the abnormal tissue and prevent further damage. Depending on the individual situation, procedures may include tympanoplasty and, when necessary, mastoidectomy. Reconstruction of the hearing bones may also be considered depending on the condition of the ear. After treatment, regular follow-up remains important because cholesteatoma can return or leave residual tissue that may grow again. Long-term monitoring by an ENT specialist may therefore be recommended. As Dr. Adam Maulana, I would also like to emphasize that not every case of ringing, ear discharge, fullness, or hearing loss means cholesteatoma. Many other ear conditions can cause similar symptoms. Therefore, do not attempt to diagnose yourself based solely on information found online. A direct medical examination remains the best way to determine the actual cause. As an important final message, the ear is a highly complex organ that plays an essential role in communication and balance. Do not wait until your hearing becomes significantly affected before seeking medical attention. If you experience persistent or recurring ear symptoms, especially changes in hearing or recurring discharge, do not ignore them. The sooner the underlying cause is identified, the sooner an appropriate treatment plan can be considered. Take good care of your ears, avoid inserting objects into the ear canal, and trust an ENT specialist for proper evaluation and treatment.